Healthcare organizations are facing unprecedented challenges, from clinician burnout and rising labor costs to supply chain disruptions and new care delivery models. Adding to these challenges is the disconnect between data from your operational systems like clinical utilization, provider productivity, and patient revenue data, and your enterprise data around finance, HR, and supply chain. Workday unifies all your data into an intelligent data core, where Workday applications allow you to plan, execute, and analyze all in a single system. And that system has a user experience that matches the way your employees want to work. For example, a busy cost center manager can immediately see alerts highlighting what needs attention today. Looking at the details, you can see that 6 employees in this cost center are a high retention risk. From a numbers perspective, that's 10% of the employees in this cost center. And looking at the names, these are some of the best RNs on the team. It's important to figure out how to address this issue quickly. The Cost Center dashboard in Workday provides a better picture of what's going on with the team from an HR perspective, and it also offers insight into the broader context with financial, clinical, and supply chain data all in one place. Focusing on the turnover report, we can see that in addition to the retention risks identified by today's alerts, several employees recently left the organization. It is easy to see if turnover is spread evenly across departments or focused within one team, like it is here. Understanding the why behind the what is critical to making the right choices, and Workday lets you drill into the data with ease. This termination analysis shows us exactly who left and why. In this case, people are looking for higher pay or they're going to the competition. Workday lets you move directly from analysis into planning, so you can model multiple scenarios to make the best decision on how to address the issue. And when you see that one team or service is performing well and has a high retention rate, you can look at the details and model what it would look like to try a similar strategy for another area. For example, this Nursing 3 East team that has 100% retention recently awarded each RN a bonus. You can even understand more about each individual. It looks like this star nurse has been getting annual raises in addition to the bonus, and he's not a retention risk. Maybe it's time to think about bonuses for Nursing 4 West. Workday makes it easy to walk through the what-if process and create a new version of the plan on the fly to determine the financial impact. Like, what would it cost to fund bonuses at 100%? In just a few clicks, you have a report that helps decision makers see the impact of a change in the same format and interface they're accustomed to using as they compare plan to actuals. Here, you can see the financial impact of actually implementing that bonus scenario. Because Workday lets you plan, analyze, and execute in one place, you can accelerate decisions by taking action right away. In today's labor market, it's much easier to give your nurses a reason to stay than to recruit and train their replacements. Having the data and tools to act quickly can make all the difference for your organization. In Workday, everything is in real time, so you can access your reports as soon as the transaction is completed. And with all that information accessible from an intelligent data core, you can quickly zoom in on any detail you need. For example, you can get from a financial report on bonus payouts to the complete profile of each of those employees with just one click. The same is true whether you're focused on finance, HR, payroll, or supply chain data managed directly in Workday, or the intersection of that data combined with data from external sources like your EHR, HCAPS, or point-of-use systems. With Workday, you're able to embrace the bigger picture, recalibrate with data-driven precision, and realize faster cycle times. Learn more about what Workday can do for healthcare organizations like yours.